I'm Lisa Berkman, and I'm a director of the Harvard Center for Population and Development Studies, and I've been at Harvard since 1995, working in departments that have been really concentrated on understanding the ways in which social conditions influence health outcomes. So among the most important of those conditions are those that have to do with social isolation. And I think we live in a country where many more people are socially isolated than have to be. And it became an important interest of mine very early on. Actually, when I was doing my doctoral dissertation, I did it on the health effects of social isolation. And what we found was that people who were socially isolated, that is, people who were either not married or didn't have many friends and relatives, or didn't belong to voluntary or religious organizations, had a mortality risk that was about 3 times as high as people who had many more sources of contacts. And one of the amazing things about this study was that it wasn't any one thing that was really determining in terms of your health risk. It was the composite. So if you had lots of friends and you didn't have relatives, you were okay. If you belonged to religious organizations, not voluntary organizations, you were okay. But as you became increasingly isolated, your health risk increased very monotonically. And this was especially true for older adults.